Hello, Dr. Andrew Howard with the Center for Advanced Dentistry in Loveland, Colorado. And today I thought I'd talk about a little bit about the different options that are available for full arch dental implants. Some of these things are starting to be marketed pretty aggressively, and I think they can be quite confusing to patients when they're trying to pick an option. The first one is 3-on-6. And this is actually a trademark name for a procedure that's been around for quite a long time. It is an option for some people, but there are several negatives that we should cover here. So the first one is that you have to have perfect bone and gum health to allow this to be done. If you have perfect bone health, it is a possibility, but there are some other issues too. The second reason that I'm not in favor of this is it is very less stable. There's a lot more stress on each implant. You use 2 implants to support 3 different segments of teeth, so a total of 6 implants, but it's broken up into 3 segments. So that puts a lot of stress on 2 implants, and if one implant in any of the segments has a problem, then you lose one whole large segment of teeth. It's also much more difficult to clean. It requires very meticulous flossing underneath each individual implant and tooth segment. And then the last reason is that recession occurs a lot more commonly with this type of treatment. And while it may look very good for the first year or so, afterwards we see a lot more recession, and if you have a high lip line, that recession will show. So that makes it also a complication that is hard to correct later on down the road. The next option that I see advertised quite a bit is same-day finals. This is mostly being done by some large corporations. First of all, it's actually not same day, it's usually the next day, so it's final teeth within 48 hours. But in my opinion, this is something that really only benefits one person only, and that is the dentist or the corporation doing it. They get to see you fewer times, and then you're pretty much done. They don't do long-term maintenance and follow-up, so really they get you in and out the door and you're done. The problem with that is that, once again, down the road, lots of complications. The number one reason is that biologically it just doesn't make sense. When you put in implants, they're very solid, but the bone has to heal. That's the reason implants work long-term. And if you put the permanent hard teeth on right away, it's like walking on a broken bone. You can't be expected to break a leg and go out and run on it the next day. And that's exactly what's happening in these situations. Also, over time, the gum position changes. It might look good for several months, but over time, the gum starts to recede, and this can cause gaps in the teeth and the implants. The other option, or the other reason, is that really when you do this, you only have one chance to look at it, and that is in the computer preview that you get beforehand. You get to see what the design is, what it's going to look like, and then you see it in your mouth when you're done, and there's no option to make changes. Patients very often want to see what it looks like in their mouth for a while. So you can kind of test drive it and say, oh, I want it a little longer, I want it a little shorter. But with this option, there's no changes at all. So the last option is what we call all-on-4, or actually more accurately, all-on-X. So X just stands for the number of implants. So we don't limit it to 4. It's the number of implants that are ideal for your situation. So that might be 4, it might be 5, it might be 6. But in this option, what we do is the surgery is planned ahead of time. All the implants are put in one visit, and then temporary 3D printed teeth are put in on the day of surgery. You wake up, you have your new temporary teeth in place. This allows the gums to heal, the bone to heal properly. Any changes that occur in cosmetics or with gum position, those can all be fine-tuned and adjusted during the 3-month healing period. Then at the end of 3 months, when your bone is nice and solid, we make the final ones based on how you have approved the temporaries. So that's a quick overview of the different options. Don't hesitate to reach out if you have questions. We'd be happy to answer them for you.